obviously I'm not in New York, I'm down here in Florida, but I haven't had to deal with those types of presentations of clients all the time.
Really?
But not as much.
Yeah.
Not necessarily like the provider. I do think that might be, and this could be my bias. I do think that might be culturally more of a New York thing more than like down here,
Yeah.
in terms of like the way that they carry themselves. But
Mm-hmm.
the point I was going to mention was how you have to deal with clients sometimes, right?
Mm-hmm.
Sometimes I'll give you like a comparison, if you will. Sometimes I will be very direct and very affirm with a client because talking around something or them feeling a little more ambiguous about something isn't going to help them to take the proper steps that they need to actually address the issue. So sometimes having to be a little more directive so that they have a very clear sort of instruction, if you will, to know what to do, how to handle the situation.
Mm-hmm.
So when I listen to you describe how you just would confront a client in that manner, to me it sounds more like sometimes you have to be very direct because you're sometimes we have to match the energy based on what we're getting. Not and I noticed you said that not in a disrespectful way, not in a I'm
Mm-hmm.
in my feelings, so I feel like I need to be combative with you way,
No.
but just sometimes I have to confront you back and challenge you back in the way that you're matching this energy so you realize you can tone it down.
Yeah.
You don't have to come in here like that.
Yeah.
I'm not your
Because
enemy
if
here.
you, I had to nip it in the bud, because if it doesn't be addressed, you gonna figure he gonna have in his mind, oh, they put up with me anyway. They're gonna feed me anyway, so I could just go ahead and act like this. Yeah, okay.
Right. And
Because
we don't
many
want
of the
that.
clients, that some of the clients know, my clients know that they can't come up in there with that attitude,
Right.
and there's some of the clients, other clients who know, who's aware of me. They're like, you don't play, you don't play. And some of my colleagues, who are, a lot of them are black women, they don't play that. And my other colleague, she don't play that either. We don't play that. We're here to help you, but what you're not gonna do, you're not gonna cross our boundaries. There's
Right.
boundaries you cannot
Correct.
cross, cannot cross.